So good day everyone. This video reporting is for my topic in chapter 3. Apraxia. So basically, apraxia is a loss of ability to perform simple voluntary acts. Apraxia is a neurological disorder characterized by loss of the ability to execute or carry out skilled movements and gestures despite having the desire and the physical ability to perform them. For example, a person with apraxia may be unable to tie their own shoelaces or button up a shirt, and people with apraxia of speech find it quite challenging to talk and express themselves through speech. Apraxia is caused by a defect in the brain pathways that contain memory of learned patterns of movement. Now next is the groups of organic mental disorders. First is the delirium. Delirium is an acutely disturbed state of mind that occurs in fever, intoxication, and other disorders and is characterized by restlessness, illusions, and incoherence of thought and speech. It is the severe impairment of information processing in the brain affecting the basic process of attention, reception, memory, and thinking. Basically, delirium can be often traced to one or more contributing factors, such as a severe or chronic illness, changes in metabolic balance such as low sodium, then medication, infection, surgery or alcohol or drug intoxication or withdrawal. And next is the dementia. Basically, it is the deterioration in intellectual functioning after completing brain maturation. The defect in the process of acquiring knowledge or skill, problem solving, and judgment. Now, dementia is basically the loss of cognitive functioning, thinking, remembering, and reasoning to such an extent that it interferes with a person's daily life and activities. Some people with dementia cannot control their emotions, and their personalities may change. Now, dementia is commonly caused by damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, thinking, behavior, and feelings can be affected. Next is the amnestic syndrome. Now basically, the amnestic syndrome is the inability to remember ongoing events more than a few minutes after they have taken place. It refers to the loss of memories such as facts, information, and experiences. Though forgetting your identity is a common plot device in movies and television, that's not generally the case in real-life amnesia. Instead, people with amnesia, also called amnestic syndrome, usually know who they are. Amnestic syndrome is a general term that describes a memory lost like drugs, alcohol, traumatic events, or conditions such as Alzheimer's disease. And next is the hallucinosis. The persistent occurrence of hallucinations, the false perception that arise in full wakefulness state. This includes hallucinations on visual and hearing or both. Refers to the presence of hallucinations in an otherwise normal mental state, without confusion, disorientation, or psychosis. Now, hallucinosis are sensory experiences that appear real but are created by your own mind. They can affect all 5 of your senses. For example, we might hear a voice that no one else in the room can hear, or see an image that isn't real. Next is the organic delusional syndrome. The organic delusional syndrome is the false belief arising in a setting of known or suspected brain damage. It is a condition with prominent delusions occurring in patients with brain dysfunctions. It has been described in a wide variety of neurological, medical, and toxic conditions and closely inmates idiopathic psychotic illness such as a schizophrenia. Now, what are the signs of a delusional syndrome? First is the poor insight into irrationality of one's delusional beliefs, believing that others are attempting to harm the person, and it is the persecutory type. Second is the erotic type, which is the belief that others are in love with the person. Now, the third is the grandiose type, which is the belief that one has great talents or a history of important achievements. And this is the type of delusions in delusional disorders that is basically mentioned earlier. The erotomatic, which is the person believes that someone is in love with them and might try to contact that person. And next is the grandiose, which is which means this person has an overinflated sense of worth, power, and knowledge or identity. And lastly is the jealous type, which is a person with this type believes their spouse or sexual partner is unfaithful, meaning unfaithful to them, like having an affair with an other individual. And then next is organic affective syndrome. The extreme or severe manic or depressive state with the impairment of the cerebral function. Basically, it is the organic affective syndrome consists of mood disturbance along with some or all the signs and symptoms of major depression, all of which, however, constitute part of a specific identifiable medical disease. Adequate treatment of the medical disease usually resolves the depressive symptomatology. Next is the organic personality syndrome. Now, the OPS, or the organic personality syndrome, basically means that it is the general personality changes following brain damage. It is a mental disorder caused by intrinsic disease which is characterized by persistent alteration of a known behavioral pattern. Changes in emotional stability, motivation, judgment, or impulse control are usually noted. It is broadly classified as a personality change due to a general medical condition. Now, what is the organic personality disorder? OPD is most often caused by lesions in three brain areas of frontal lobe. The traumatic brain injuries in orbitofrontal cortex and anterior cingulate cortex, and lastly is the dorsolateral prefrontal cortex. And OPD may also be caused by lesions in other circumscribed brain areas. Next is the general paresis, also called dementia paralytica. Now, it is a syphilitic infection of the brain and involving impairment of the CNS. General paresis is one form of neurosyphilis. It usually occurs in people who have the untreated syphilis for many years. Syphilis is bacterial and infection that is most often spread through sexual or non-sexual contact. But today, neurosyphilis is very rare. The next is the question, what are the symptoms of general paresis? First is the memory problems. Next is the language problems such as saying or writing words incorrectly. Decreased mental function such as problems thinking and with judgment. Mood changes, and lastly is the personality changes such as delusions, hallucinations, irritability, and inappropriate behavior. For my video reporting, that would be all, and thank you so much for your time.